Hello and welcome to Happy Health Hour, Vadera University. Today I'm joined, like I was in our first two episodes, by Dr Pariksith Singh, but Dr P, affectionately as we know him. And we're also joined today by Dr Maria Scunziano Singh, who is the partner of Dr P, and also the partner of Access Healthcare, co-owner of Access Healthcare Physicians. Maria, we are delighted to have you here today. I have a quick question for you before we start.
Anything at all?
Well, the question is, we gave Pariksith the handle Dr P. Is it okay that we would give you the handle Dr M? I quite like that, and I just think it works. Dr P likes Dr P. Do you like Dr M? Can we go with that?
I wouldn't have it any other way.
Thank you. we like that. And Dr P, how have you been since last week?
All good, working hard and trying to keep things moving.
And Dr. M, we're joined by you this week, and we're going to be joined by you on subsequent episodes too. But specifically, we want to hear about your story. You're a physician, but you're much more than that. And we want to hear your story about how you came to something called integrative health. Please talk about your story, how you came to it, and what integrative health means.
My story is a long one. I'm not going to bore you with all the details, but having met with someone very close to me who had a very serious illness back in the day, my own mother, she was not someone who was exposed to the type of medicine, the type of health care that I have and that we have now. So she's no longer with us, but she suffered. And she suffered with, or at the hands of conventional therapies, as we say. Conventional therapy did not really help her. And it was I guess it was my goal to find out what else there was out there that can really take care of a person, that a person with chronic illness, how that person can look to other directions. What is there besides a drug, and just a few minor things that they would give her. There's got to be a lot more. So I looked and I knew that there was something else, and it was really early on. I was, my early 20s when I really started to look at changing my life and helping Mom change her life. And, looking at nutrition and lifestyle and how all the different aspects of one's life can impact their health, all the environmental things and so forth, the influence of everything around us, how that, fed into the disease process. How could I change that? And it was through reading, getting in touch with different peoples, exploring these elements. Even before medical school, I was looking in this direction to help myself and to help my mom, and then subsequently to help others. So it was a journey through really researching a lot of different pathways, and I was looking for natural pathways. And I came across different things, and I was influenced by certain peoples in different cultures, and so I studied. And then I knew medical school was where I wanted to go because I wanted to teach, and I wanted to take these things that I started to learn about and apply them. But I realized that when I went into medical training, it wasn't exactly what I had been seeing, so I knew that there was something amiss, and something was missing, at least in my little world. So I had to find what was missing. And so I went through my medical training, And then I started to read more, and then want to get all of this other business that was really intriguing me into my world of medical care, of health care. I say those two words, they're not quite interchangeable, but I wanted healthier ways for all that I would see. And I started out with a naturopathic course that would accompany my medical degree. But I would do it a little later because I started having children and I started practicing. So I had a little delay there, but I got into the naturopathy and I got a diploma in that. And thanks to my husband and my daughter, they were helping me type up my thesis for that. That was very interesting. And then subsequent to that, I just kept up with all of the world of naturopathic medicine, which is is vast. And I realized, wow, there's a whole lot here. And then I went on to something called lifestyle medicine, and I did that, a little bit later. Sat for boards for that. So lifestyle medicine is encompassing so many elements of life and how we can change our lives. We can change the course of our life, and prevent disease, and even treat disease with nutrition, for instance. In between that, I studied macrobiotics, which had a lot of influence on this person here. I was very much into the energy of food and how it really made the difference. So that thrown in there. And then I was invited into Andrew Weil's Center for Integrative Medicine a couple of years ago, and I happily accepted their invitation into that program, and that program led to a recent graduation, and awarding a diploma in integrative medicine. So what is integrative medicine? And that's what you're going to ask me, I'm sure.
It is, absolutely. So you may as well answer your own question then.
Yeah. So it basically is a kind of like a meeting of worlds. It's taking in the conventional medicine that we've been trained to do, and that conventional medicine is very young medicine. Let's put it that way. I mean, it's only a little over 100 years old, and it takes that and that kind of training and the technology and the clinical work, and puts alongside it, or actually integrates with it, the traditional or the old ways which have come to the fro, the old ways of treating people, which are using herbs, using botanicals, using sunlight, using energy work, hands-on, things you may have heard of, like Reiki and energy medicine. These are powerful, and now we have that which is so-called scientific and proven materials that have allowed us to put that into the care plan, into the health of the individual, to bring this together, bring these worlds together, so that you don't only have drugs and surgery, those type of modalities, which are really very limited, and they don't look at the whole person. They're kind of, it's piecemeal. It's just, oh, you have a pain, you have this, oh, we're just going to focus on this part. So integrative is really all encompassing, and it takes the whole person into account. It is, bringing all aspects of a person, their lifestyle, and emphasizing the therapy between the practitioner and the patient. And it really brings it to focusing on, what does this person in front of me really need, and what are they all about? Mm-hmm. So it's not limited to a part, it's the whole. So in a sense, it's a holistic approach, and you have all the tools from these different disciplines. And so I'm happy to say that I've learned a lot, and I will continue to learn, because it's just a never-ending learning.
So let me come back and ask more questions about that in a moment, Dr. M. But Dr. P, so how do you fit in with integrative medicine? What are your views, and how do you practice medicine? And how does the partnership work?
Well, for me, it's very simple. I just send all the patients to Dr. Scunziano, Dr. M, and that's how I integrate with integrative medicine. If they need something more, the women need more care. If they need, I believe, if my meds are not working, there are other issues, emotional, psychological, cultural, spiritual, mental, physical issues. I said, okay, you go to see Dr. Scunziano, and I'm done. And that's how I practice integrative medicine.
It
I
sounds like
integrate.
you've got the easier job. It sounds like
No,
you
no,
guys,
no, no.
yeah,
It's
you got
far
the
more
harder
difficult.
job. Is that what you're telling me?
It's
Really?
much more difficult to see. Look,
I
a
see.
physician who is brought up in the traditional system of medicine.
Hmm.
There is something called,
Conventional.
of course, conventional,
Conventional.
traditional. Okay, the new system of medicine, the allopathic system of medicine. There is something called ego, personal ego. Then there is something called a professional ego, and we all suffer from a professional ego. That is the ego of our profession, right? We come in, we have a ritual, we wear the white coat, then we have the flames coming up, the priest walks in, and the shaman comes in, and I do my woo woo and all that stuff. But then it's very difficult for me to say I don't know the answer, right? So
Mm.
in the old days, if the shaman would say that, then they would burn the shaman. Shaman would end his life. Shaman couldn't say that. For me to say that, look, there is someone who can approach your condition in a different way. I think that is an important thing, and it's relatively easy for me because I come from a culture where different systems of medicine coexist,
Yeah.
and for
Okay.
me it was not difficult. So yoga, meditation, part of it, homeopathy,
Mhm.
ayurveda, very powerful part of the Indian system. Unfortunately, it's been overwhelmed by the 200-year-old system of medicine that we call the allopathic system. And then the problem is the allopathic system has the money, the technology, the political influence, and the narrative. And
Okay.
so, to me, it is at some point we come to a realization: what is it that is going to have the patient feel good about himself or herself? Wellness, right? The simple massage and a simple Ayurvedic healing, change in diet. What is it that will make them feel well? So it's that way. It's a little easy for me to get out of my own way and allow the patient the opportunity to heal.
Fascinating. Thank you for that, Dr. M. I won't go into too many details, but you really helped me overcome some. Well, probably I thought they were serious, but they were probably minor ailments. But you completely solved them by talking to me on for a total of 4 hours, and you solved it completely by nutrition. Um, but this is time intensive for you, isn't it? So just let's move away from the 30,000 feet view and get down to what your day looks like. Talk us through what a patient consultation looks like, and how it works, and how you find out, and how you progress, and how you diagnose, and how you recommend.
Uh, yeah, it is. It is time. It takes the time for sure, and everybody's on a time schedule. In the conventional office that we have, I have only a certain amount of time, and usually it's a 15-minute slot. It's like totally unrealistic. What do you learn in 15 minutes? I mean, if you're speed talking and patients saying nothing essentially, and you just say blah, 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 then you're out 15 minutes. 15 minutes is not enough time. It just flies by. And so what happens is I end up generally going over 15 minutes. It's almost invariably the case. And people wait. They wait because I'm going to add something in there that I think would be advantageous to them, that I think they should hear, and that they're really looking for. So when they come to the office to see me, they know, you have that holistic thing, don't you? And you're the holistic doctor, so I want to hear more, and I want. So the more they want, the more I try to give, but I have to let them know, look, I only have so much time, and you'll have to come back, and so on, and they don't mind. But yes, it is timely. And what I do is I really get into, the whole kit and caboodle. I mean, I'm asking them every question. And when I'm in my other office, the office where I am now, and my Om Center, which we call Integrative Healing at Om, I take the time. I usually give the patient 90 minutes, sometimes 2 hours. If they want to stay for 2 hours or longer, we can be that long. And, I have to get down to, where they were born, whether their mother was taking drugs or not, whether they were in a strange environment when they were young, all the doings of their childhood, right up to their age, whatever that age may be. And I have 12 and up, so I see adolescents, teenagers, I see people all the way up to 100 years, and I ask them about everything, and weaved into that, as I'm asking them the questions, I'm formulating my plan, because each person has their own. Everybody has their own story. Everybody has their own traumas, trials, tribulations, all that, which we all have. Some have much more intense than others. So we really get into what they've suffered. And if they didn't suffer, of course, some people don't suffer that much, or maybe none at all. We talk about how they can improve their life, because a lot of people come in, they want to know how they can better themselves in every way. But those who've had a lot, those who have a lot of diagnoses and so on, I try to, sort these things out for them. We get to root cause. I try to get down to where these things started. And it could be that all of the things they have, say they have 5 diagnoses, all those could be coming from the same source. And they just manifesting differently. So they'll have sugar problems, they have liver problems, they have brain problems, headaches, so on and so forth. So I find out where things have gone wrong. And it's everything and anything, environmental, food, so on and so forth, in their homes, their fixtures, their materials they use to clean themselves and their homes. Do they have animals? I have to know what is causing what. And, and then there are all the modalities. There are various things that are used. And it could be, as Dr. P said, yoga, massage. We have salt rooms where people inhale salt. We have red light. We have infusions of nutrients and chelators, which take metals out of the body. We have all of these different things that I can offer. I offer energy work, hands-on meditation with them, breathing work with them. We see great things happen, when these people are exposed to this stuff, and they say, wow, I feel so much better. I demedicate. I try to take them off of medicines, because a lot of medicines can be detrimental and can cause all kinds of nasty things. So we try to take out what they don't need from the conventional world. If someone else has ordered the medicine, they say to me, for instance, I don't want to be on this medicine anymore. Can you take me off? Well, we work at it, and we're successful in many cases. So that's part of it. I kind of go through so much with them. By the time they leave, their heads are like, whoa. But they leave with good feeling, usually. They usually leave smiling and optimistic. And they leave with things that they can hold in their hand. I have written materials that they can take with them, and instructions on what to do, and then we follow up and so on with the rest of the plan. So it's yeah, it takes time, and
Mm.
that's what it's all about. It does take me time, but they're willing to give the time, and as long as that's the case, then that's where we have to go.
Dr. M, I'm going to come back to you momentarily to talk about the Ohm Center that you've described. I'm going to want a fuller explanation of that. But Dr. P, in case Dr. M is going to be modest, can you talk about the success stories, some of the anonymized success stories, patient success stories, and just give us some case studies about what the successes have been. I can offer myself as a success story there, but please can you sort of put some more meat on that?
So I have the pleasure of knowing Maria for almost 30 years now, and the best part of it is you're constantly growing. I mean, she has constantly grown, adapted, learned, and tried new ideas. And over the last 30 years, we've had quite a few interesting cases. And the most, right now, as you ask me, one very remarkable case comes to my mind was a young woman, and Maria might remember her. She had, this is, you're talking about, I think, a teenager, 13, 14 years old girl, and her whole body, her whole skin was diseased. She had psoriasis. What is called psoriasis means, and this was a severe psoriasis. This was not a mild psoriasis. And imagine a young girl having that, all her skin peeling off, flakes falling off,
Mm.
and all the traditional treatments had failed on her. And she came to Maria, and when I saw her, I didn't see her as a physician because I would have fixed her right away, but I would have sent her right away to Maria, and that would have been my prescription. But
Yeah.
it took her a long time because she didn't have anywhere else to refer the person to. But finally, I know Maria put her on a diet, on a very strict diet, and then I believe she even went to uh, the Macrobiotic Institute that was still alive in those days. Now it's shut down, so Maria has started her own macrobiotic. I have the microbiotic. She has the macrobiotic institution. I
Oh, I
deal
want to
with
hear
the.
about this in a moment, but I want to hear about this
So unfortunately, that institute has shut down. But now Maria has taken over, and so the young girl, I saw her 3 months later, and I was astounded. Usually we don't expect such a remarkable improvement in a patient, and such a patient with severe psoriasis, you don't expect improvement at all. You don't. And it almost reminded me of that. We had gone to this Ayurvedic college in Jaipur in India, where I come from. 50 cases of vitiligo. This professor had treated them with his own uh, treatment, Ayurvedic treatment, and pictures, and before and after, and the vitiligo disappeared. So imagine, young people getting rid of their vitiligo, and this young girl, and then Maria might. I don't know if she's still following her or if she'll in touch with her. That was a remarkable, and not just for physical reasons, but emotional, cultural, psychological, all the issues that a young woman would go through. It was amazing.
Um, may I add, she went on to have a successful pregnancy. She gave birth. She was seeing a new life, and her mother, who had referred her, again to us and to our practice. Her mother told me of this story, and they were just transformed. It was just a big transformation, and they were astounded.
But if I may add, we don't looking for big victories. This is a
Mm.
this is not a sprint, 100-meter sprint. This is a marathon of a marathon, right? This is a constant thing. So I think the more important thing is a deeper engagement with the patient, a sense of being together in the journey, a sense of not being above hierarchically and telling the patient what to do, but involving the patient, having the patient feel that they are an intimate part of their own journey towards self improvement and healing, then the results are whatever they are. Because life is not a mathematical equation. You do 1 + 1 and you will get 5 all the time. It doesn't work like that. It sometimes will be 2, it sometimes will be something else. But we give them an opportunity to experience life in a deeper way. To me, that is what the holistic part of it is. And I
Mm.
think that's where Maria's deep compassion, empathy for patients, attempt to try new things, and have fun with the patients. A lot of these patients, they've become part of our family, and you become very close to them, and they know that the doctor cares for me.
Mm.
Then it's whatever happens. You can't create a. It's not a chemical equation, right?
Mm.
So that is I think, the best part of this. Every patient then becomes a victory. You're not looking for
Mm.
special results. We have become result oriented. We forget the process. We forget the journey. If we
Mm.
start, and they come scared. Who is that comedian? Who the if you remember, like, you're in third grade again when you go to the doctor. Are you going to listen to me? Yes, I will. Are you going to not pay attention? No, I will pay it. I mean, this is what he does. This is what patients are looking up to someone and who's scolding them, and they have to do that. Attitude is, I think, only a limited partial approach. We need a
Mm.
different approach, and that's what Maria brings. And I think a future of medicine that is involves the patient deeply, with respect, with as part of the conscious growth, is critical. We need to remember that.
Thank you for sharing all of that. Dr. M, you started describing the center, the integrative center, which I think you call the OM center. Could you just give us a fuller description? Obviously, you can't show us around with the camera, and maybe we can do that on a subsequent episode. But could you give us a description of the center and all its facilities for your patients?
Yes. First of all, it encompasses probably about 7 or 8 acres, and it's right sort of in the heart of our little town, Spring Hill. Most people say, "How do you have a place like this? I never thought a place like this could exist in this town." And I said, "Well, why not? Why not?" My husband and I, we were able to we were fortunate enough to have the land, and I said, this would be a great place to build a center. And so we broke ground in 2017, finished in 2018, opened it up at the end of 2018. Uh, it all worked out well because 2019 and 2020 comes, and guess what hits? So we were there to see all that through. The C word. I'm not going to even talk about it.
Another
Um,
episode. The C word is another episode. Yeah.
so this center, the Welcome Om Integral Healing and Education Center, I named it in such a way that people are welcome. Number one, and two, we are here to educate. We're here really to educate people. That's what a doctor is. The word doctor is a teacher. So we're here to educate, and we're here to help people heal. We ourselves, we can heal ourselves. So we're here as facilitators. I'm here to facilitate a person's healing, to help them understand where it's coming from. Like I said, root cause, and where all these things come together, and how that makes a disease happen. It just doesn't come out of the air. It just doesn't come out of whatever. All of a sudden I have a cancer, or I have a diabetes, or I have a headache. It just doesn't come that way. There's a reason for everything. So we're here, with all of these different things that we offer. We started out with our yoga center. We had that available. I didn't open up integrative, the actual me and patient, interaction immediately, but it came shortly into it, and so we had to finish the building, and so we have essentially 4 buildings, and I'm in the Heal building. This is the Heal building, right? We call it our Blue Heal building, and then we have an education building, which is a venue where we do lectures, and other people use it for other things too. We have meetings in there, and then I have a motion or movement center. And then I have another building which is meant for cafe and nutritional purposes. So we have things going on there. And all of these on this one campus. It's a pretty campus. We have beautiful gardening and people who are tending to garden outside. So I have my outdoor team as well. We have an indoor team. You've been here. So it's it's got life, it's got gardens. We have people who come and join in a community garden, and then there are people who want to just take some of the beds and rent them and grow their food here because we have great soil here. We provide people with good soil. And then, we have our market. We have a market here where people can buy conscious things. We call it the conscious market, conscious gifts, whether they're apparel or they're instruments or they're books. We have books, we have supplements, we have essential oils, we have, a lot of different things that people craft. We have crafts that come from India and from other countries as well. So we have all of these things. People can join in exercise classes, yoga classes, meditation. We have life coaching. We have canning classes where people can learn to put their food together. And we have a cafe that's kind of open, not open right now. We're still working on that. We were giving cooking classes. And then we have massage. We have a salt room. People get great benefits from the salt room. We have people come practically every day to just take that salt in, which is very healing, very therapeutic.
Can you describe that? What is that? I don't quite understand the salt room. What is that? Is it a steam room with salt, or is it something else?
It's not a steam room. We have what's called a halo generator. It brings out, it spews out salt in very fine particulate form. And people breathe it in. You can breathe it in. And people say, oh, well, that salt, will that increase my blood pressure or cause me other problems? Not at all. It's pharmaceutical grade salt, so it's not going to harm you. And people can go into the room with salt bricks around. So there's nice lit up salt bricks. So they're in this, have this ambiance of like an amber color. It's very pretty, and then there's salt on the ground, and their feet, they can have like their socks, in their stocking feet, they can stand on that, and then they can recline in the chairs. Children come in with their parents, so parents love to bring their kids in there because it helps with their respiratory issues. If they have colds or they're coughing and so forth. People have asthma, bronchitis, COPD, all these different conditions of the lung. They go in there and they feel better. So it does something for them. It's also very relaxing. People just go in there to relax, just to get away from all the madness. Put the cell phones outside and, just let me just be away from all of that. So this halo generator, halo comes from the Greek word meaning salt. The halo generator is what brings it out. And so we have the salt room going every day. People just come and they keep coming. And so, then we have memberships and so forth, and people come and they take advantage of the different things that are going on at the center. As far as, my role and my thing is, I'm here, I'm seeing patients on a regular basis, and taking the time with them and doing different modalities with them, helping them, and then referring them to different things that we have here. I do send them sometimes to some outside places and so forth where they can get a few other things done if they need them. But most of the stuff is in-house, and we try to take care of everything under one roof. That one-stop shopping type of thing.
It sounds holistic and comprising a lot of things that I actually didn't realize. You must have expanded it since I've been there a few years ago. We're sort of out of time, so you must promise that we're going to carry on this conversation on another episode. But for now, both a question to both of you in concluding this episode: what is future plans? To talk about any future plans to do with integrative health and the Om Center.
Well, let me speak first. So Maria does all this, salt and conscious healing and all that. We don't do that. We're going to put up an assault room. So the moment you come, you're going to be assaulted with questions, with issues, with chemicals. That'll be our way to complementary medicine. And then we'll have a disease.
I don't think that was quite when people talked about complementary medicine, I don't think that's quite what they meant, but it's very funny anyway.
It's the yin and yang. I want to bring the yin and yang approach from macrobiotics. Second, then we'll have a disease center. You have disease, and there'll be an unconscious market. So everything you do unconsciously, you do that. And then you go to Maria and you see the change. You become conscious, you become healed, you become whole, and then you're just salted.
I'm going to ask you, Dr. P, that you keep up the comedy, because I like it. You keep up the comedy on all episodes, because I don't know if anybody else likes it, but I like it. So please keep it up. And Dr. M, the final word to you. Future plans. Any future plans that you'd like to share with us as we close?
I'd like to stamp out the disease center that my husband is talking about completely, and we'd like to have everybody join in on this journey through total care, full mind, body, spirit, the whole thing. That's where it's going. That's where it is right now, as far as I'm concerned. This other playing around with disease care is going to kind of fade out, because it's not sustainable, not the way the whole system has been, and many people are seeing that. The trust in conventional medical care has gone way down. As of last year, it went down to about a 40% trust in doctors. This year, it's probably in the 20 to 30% range, I would say. So people are looking for the holistic approach. They do not trust just the hard pharmaceutical, etc. approach, all that goes along with pharmaceuticals. So I'd like to see everybody really integrative, and we're just going to keep expanding. We're going to keep growing. Hopefully I can recruit more, and my husband too. And
maybe a second Om Center somewhere? Maybe close to where I live?
We'll keep multiplying. If we can multiply, and bear fruit, that'll be great.
Dr. M, thank you so much. Dr. P, thank you. Dr. P will definitely be back next week. And Dr. M, we need to talk about your schedule and where you can fit us in your busy schedule, because I know this is 1 o'clock, 2 o'clock in the afternoon for you. But thank you so much for sharing all about integrative medicine and the Om Center. And Dr. P, as usual, thank you for your healthcare advice and your comedy. It's a pleasure as always.
Welcome.
Thank you.